Arousal Regulation, Chapter 13. Why regulate arousal? Athletes need to be able to regulate their arousal to stay focused and in control. You must increase your awareness of your psychological states before you can control your thoughts and feelings. Once you are aware of your optimal arousal, then you can employ arousal regulation, such as reduction, maintenance, or induction strategies. People who do not effectively cope with stress may experience decreases in performance, as well as mental and physical distress. How someone copes with anxiety is more important than how much anxiety they have. Our goal is to learn to regulate arousal, to stay focused, and to stay in control. We must increase our awareness of our psychological states before we can control our thoughts and our feelings. Athletes should be encouraged to learn a broad spectrum of coping strategies to be able to use in different situations and for different forms of stress. Lazarus and Folkman define coping as a process of constantly changing cognitive and behavioral efforts to manage specific external and/or internal demands or conflicts, appraised as taking or exceeding one's resources. As we are talking about performance, we need to go back to the inverted U hypothesis. Just as a refresher, the inverted U hypothesis suggests that above a certain level of arousal, your performance will decrease, as an extreme level of arousal can lead to a lack of awareness and attention outside oneself. According to the theory, performance will improve as arousal increases until it reaches a certain point where optimal performance is achieved, and arousal is at its optimal level. If arousal increases beyond this point, performance will begin to deteriorate. This will be important to keep in mind as we discuss arousal regulation. We would like to keep our patients or our athletes in the green as much as possible. This can help them to increase their effectiveness of their performances. Sports psychologists have noted that performance does not always gradually decrease as arousal increases, as is shown in the inverted U theory. Instead, many top sports people go to pieces while trying to perform for their big event. Catastrophe theory shows a much more dramatic decline in performance. Physiological arousal is related to performance in an inverted U fashion when the athlete is not worried or has low cognitive anxiety or state anxiety. If cognitive anxiety is high, the increases in arousal pass a point of optimal arousal and a rapid decline in performance occurs, also known as the catastrophe. It would be very difficult to recover from this point. The theory takes into account that anxiety, or a negative reaction of a performer to stress, can be of two types, either somatic anxiety or cognitive anxiety. Somatic anxiety is physiological, such as sweating. Cognitive anxiety is psychological, such as worrying about failing. Cognitive anxiety is probably the most crucial in determining performers' reactions to high levels of stress. The catastrophe theory concludes that increases in levels of cognitive anxiety will help performance if somatic anxiety is low. So if the body is relaxed but the performer is feeling anxious, then this anxiety can help to improve performance. If there is an increase in cognitive anxiety and somatic anxiety is high, then performance will decline. If there are high levels of cognitive anxiety and there is a continuous increase in somatic anxiety or physiological arousal, then performance can suddenly deteriorate, also known as the catastrophic response. After this catastrophic effect, arousal decreases, then performance will once again improve, but not back to its original optimum level. Anxiety is part of life. So one might ask ourselves, if it's part of life, how can we get control back and manage our lives and performances? We can increase the awareness of our psychological states. Once we are aware, we can learn to regulate it. Coping with anxiety is more important than how much anxiety you experience. Reducing somatic anxiety. Somatic anxiety is the physical symptoms of anxiety, feelings such as having butterflies in the stomach or sweating. It is commonly contrasted with cognitive anxiety, which is the mental manifestation of anxiety, or the specific thought processes that occur during anxiety, such as concern or worry. Progressive relaxation is a technique that can be utilized to assist with somatic anxiety symptoms. This technique involves tensing and relaxing specific muscles. The tensing and relaxing progresses from one major muscle group to the next until all muscle groups are completely relaxed. Progressive relaxation is a true somatic technique. It's easy to learn. The basic principle is to learn to feel the tension in your muscles, and then let go of all the tension and let the muscles become heavy. It's also easy to learn to control breathing in stressful situations, which can be extremely helpful. Anxiety can affect our breathing. Proper breathing is often considered key to achieving relaxation. Breath control is another somatic-oriented relaxation technique. Breathing control is an easy, effective way to control anxiety and muscle tension. When we are calm, our breathing is likely to be smooth, deep, and rhythmic. When we are stressed or under pressure or are tense, your breathing is more likely to be short, shallow, and irregular. Biofeedback is a physically oriented technique teaching people to control their physiological or autonomic responses. This technique typically involves an electronic monitoring device. This detects and amplifies internal responses we usually aren't even aware of, such as muscle activity, skin temperature, brain waves, or even heart rate. The majority of relaxation techniques focus on efferent nerve control. This includes the stimulation from the brain to the muscles. The techniques for dealing with cognitive anxiety focus more directly on relaxing the mind than do progressive relaxation and deep breathing. Both techniques result in a relaxed state, however, they work through different pathways. The cognitive relaxation response occurs when we teach the individual how to quiet the mind, concentrate, and reduce muscle tension. Most of these techniques apply the basic elements of meditation. Meditation teaches you to quiet the mind, concentrate, and reduce muscle tension. The practice of meditation involves the practice of mindfulness or teaching centering. Regular meditation practices help to teach a deep state of relaxation, and it also facilitates concentration by disciplining the mind. The relaxation response teaches you to quiet the mind, which will help you to concentrate and reduce muscle tension. Learning the relaxation response takes time. You should practice it about 20 minutes a day. It can sometimes be extremely difficult, depending on our circumstances, to control your mind and to focus on one thought or object. What does meditation and relaxation response require? It requires a quiet environment, finding a comfortable position, and you may have to employ a mental device to help quiet the mind. Some people use the image of a blank chalkboard, and the goal is to keep it blank. For example, getting rid of any outside thoughts. It can also help to have a passive attitude. You cannot get disappointed if you get distracted. Rather, refocus yourself, maybe having the blank chalkboard appear again to refocus yourself, and then try again. Don't get disappointed if you don't get it right away. In the human brain, millions of nerve cells communicate with each other by emitting tiny electrical impulses. This activity can be registered as oscillations, properly called brainwaves, by placing electrodes on the scalp, which amplifies these signals and displays them on a computer monitor. This method of measuring is called electroencephalography, or EEG. Alpha, beta, theta, and delta are all different brainwave activity. Brainwave activity tends to fall into 4 groups. These categories are associated with the rapidity of oscillations or frequency of the brainwaves. As it turns out, certain patterns of brainwave activity are associated with specific mental states. Beta waves, typically 15 to 30 oscillations or waves per second, also known as hertz. This is the brainwave rhythm that is in normal wakeful states associated with thinking, conscious problem solving, and active attention directed towards the outer world. You are most likely in a beta state while you're reading this or while you're watching this video. Alpha waves are a little bit slower, around 9 to 14 hertz. When you are truly relaxed, your brain activity slows from the rapid patterns of beta into a more gentle wave of alpha. Fresh creative energy begins to flow. Fears vanish, and you experience a liberating sense of peace and well-being. The alpha state is where meditation starts, and you begin to access a wealth of creativity that lies just below our conscious awareness. An alpha state is the gateway that leads into deeper states of consciousness. Theta waves are even slower than alpha waves, around 4 to 8 hertz. Going deeper into relaxation and meditation, you enter the theta state, where brain activity slows almost to the point of sleep. Theta brings forward heightened states of receptivity, flashes of dreamlike imagery, inspiration, and sometimes your long-forgotten memories. This can also give you a sensation of floating. Theta is one of the more elusive and extraordinary realms that we can explore. It is also known as a twilight state in which we normally only experience fleetingly as we rise up out of the depths of delta sleep upon waking or drifting off to sleep. In theta, we are in a waking dream, and we are receptive to information beyond our normal conscious awareness. Some people believe that theta meditation awakens intuition and other extrasensory perception skills. Delta waves are the slowest, 1 to 3 hertz. This slowest of the brainwave activity is found during sleep or dreamless sleep. It's also sometimes found in very, very experienced meditators. During unconscious states, such as deep sleep, the slow delta waves are dominant, whereas it is the high-frequency beta waves that are prevalent during conscious wakeful activity. The vagus nerve is sometimes known as the meditation highway. What is the vagus nerve? It is the longest nerve in your body. The name roughly translates to wandering nerve, which kind of makes sense. The vagus nerve travels from your brainstem, winding down through your body to finish in your abdomen. On the way, it connects with many major organs, including the heart and lungs. We've been aware of it for a very long time and have been similarly aware of the fact that the vagus nerve is semi-responsible for your body's regulation of heart rate, breathing rate, digestion, and so forth. The mind has a great influence over the body, and maladies often have their origin there. Your immune system is controlled by a nerve called the vagus nerve, But this isn't just any nerve. This is the most important nerve coming from the brain and travels to all of the major organs. And you can activate this nerve through relaxation, meditation, and other ancient practices. But what is the benefit of that? Well, by activating the vagus nerve, you can control your immune cells, reduce inflammation, and even prevent diseases and aging. It's true. By creating positive brain states, such as meditation masters have done for centuries, you can switch on the vagus nerve and help to control inflammation. There are many known possible benefits of meditation, such as relaxation, feeling a sense of balance, reduction in anxiety, anger, and pain, increases in energy, assistance with the prevention of heart disease. It helps us to control our thoughts and reduces stress. These benefits are largely due to the vagus nerve's ability to influence the parasympathetic nerve system. Another thing we should examine is autogenic training. Autogenic training is a series of warmth and heaviness. This was initially used by mostly European athletes. However, it is now much more popular in the United States. Within autogenic training, attention is focused on the sensations that you are trying to produce. As the relaxation response, feeling should be allowed to happen without interference. There is a series of exercises designed to produce two physical sensations, warmth and heaviness. Both sensations can lead to relaxation. This is a form of auto or self-hypnosis. In order for autogenic training to work, we need to place attention on the sensations to be produced. The autogenic training program is based on 6 hierarchical stages, which should be learned in order. First, heaviness within the extremities. Second, warmth in the extremities. Third, regulation of cardiac activity. Fourth, regulation of breathing. Fifth, abdominal warmth. And finally, sixth, the cooling of the forehead. This generally takes several months of regular practice of around 10 to 40 minutes per day to become proficient. Multimodal stress management packages work to alleviate both cognitive and somatic anxiety and provide systematic strategies to developing coping procedures for stressful situations. A key feature of these techniques is that they will help athletes develop a number of coping skills for managing a wide variety of problems resulting from stressful situations. Cognitive Affective Stress Management Training is also known as SMT. SMT teaches a person specific integrated coping responses. It uses relaxation and cognitive components to control arousal. You are exposed to and learn to cope with stress in increasing amounts, and this is accomplished through productive thoughts, mental images, and self-statements. This can also enhance stress immunity. This can help to give us the tools to deal with increasing amounts of stress. Other techniques include hypnosis. Hypnosis is defined as an altered state of consciousness that can be induced by a procedure in which a person is in an unusually relaxed state and responds to suggestions for making alterations in perceptions, feelings, thoughts, or actions. Stress inoculation training is another thing. The individual is exposed and learns to cope with stress in increasing amounts, thereby enhancing their immunity to stress. Stress inoculation training, or SIT, teaches skills for coping with psychological stressors and for enhancing performance. The matching hypothesis theory. This hypothesis states that an anxiety management technique should be matched to a particular anxiety problem. We should treat cognitive anxiety with mental relaxation, and somatic anxiety should be treated with physical relaxation. If you are not sure exactly which type of anxiety is occurring, we can use the multimodal technique. Coping is a dynamic process involving the cognitive and behavioral efforts to manage stress. Problem-focused coping is an effort to alter or manage the problem that is causing the stress. For example, if the issue is time management, we could use a technique known as problem-solving skills training. Problem-focused coping can be used when stressful situations can be altered. Emotion-focused coping focuses on regulating the emotional responses to the problem that causes the stress. For example, if the issue is relaxation, we could use meditation strategies. Emotion-focused coping should be used when situations are not likely to change. Dealing with stress is never easy, especially for the circumstances we are currently in. If you're having problems coping, please reach out to me and I can provide you with additional resources. We have counseling services on campus that are here to assist. I want you to know that there are digital counseling services that are available as well. So please reach out and let me know if you are struggling. I know these are difficult times and we're all dealing with our own situation. I'm here to help and be supportive, so please let me know what I can do.